Assalamualaikum. When I tell you to live healthy, what first comes to mind? So most of us would think about eating well or exercising regularly. These are the most common themes that dominate our conversations around health. But on eating well, only about 40% of people globally, they can't afford a healthy diet. That's almost 3 billion people. Now, the FAO, which is the Food and Agriculture Organization of the United Nations, found that for many people in 2024, eating well isn't possible because they can't afford it. So yes, healthy living is about making healthy choices, but only if you have the chance or if you have the luxury to make them. I can't tell my patients to eat healthier if they don't have access to affordable, nutritious food. Just like I can't tell them to exercise more regularly or take better care of their health if they're juggling 2 jobs and 3 kids. And that's why at Doctors on Ground, we believe that healthy living exists within systems. Take Kak Fatimah, for example. So Kak Fatimah is a single mother. She has 1 young child. And she also has a diabetic foot ulcer, which would need to be changed every 2 days. And the closest hospital or clinic is about a 15-minute bus ride away. So her journey actually starts on the 23rd floor of a low-cost housing unit, or what we know as a PPR, for example. But this PPR, the lift only goes up to the 15th floor. So she would have to take the extra 8 floors down. But once outside, she has to be very careful in navigating around potholes, sinkholes, broken pavements, just so that she can get to the bus stop. Once she's at the bus stop, there is no bench, there is no shelter. And so she and her young child would have to wait under the hot sun for a delayed bus. And by the time she gets to the clinic, there's already a line. She missed her appointment, and worst of all, her young child is crying. So I ask you, if this were your health journey, would you keep showing up? So healthy living isn't necessarily about willpower. It's structural. It's in the way we design our cities. It's in how accessible our infrastructure is. It's in the experience of the most vulnerable, like Kak Fatimah, in navigating these systems. One of the most invisible factors when we talk about healthy living is actually support. And there is a lot of evidence that discusses this. Studies found that people with strong social support are actually 50% more likely to survive health challenges. And this goes from chronic illness all the way up to mental health crises. In fact, social isolation has been compared to smoking 15 cigarettes a day in terms of health risk. There are actually many studies that actually discuss how social connection influences health. And because of this, we know that health isn't something that we build alone. It's sustained by the environments that we are in. It's by the people that notice that we're not okay, our friends, our family. So when we frame healthy living as something that's an individual responsibility, we tend to forget all of the other factors that go into healthy living. The burden of illness is something that no one wants to take on. Everyone wants to get better. Everyone wants to be well. But not all of us have the same circumstances. So when thinking about designing better systems, not only for us, but for everyone, the big question remains, what can we do? What does it look like? But as individuals, the best thing that we can do is show up. So that would mean looking at your neighborhood. Who's sick? Who's elderly? And do these people have the resources and the people to get them better? As communities and organizations, it's important to create the space. So for example, I live in a rather affluent neighborhood, so the realities of the marginalized is almost invisible to me. So at Doctors on Ground or other NGOs, what they tend to do is they tend to highlight the struggles of these communities and allow volunteers to come in and witness what it looks like to live healthy as someone who doesn't really earn the same income. As governments, it's important to look at the access of care from a whole, looking at the experience of infrastructure, looking at the experience of how our towns are built, at our public transport, and seeing if they all are accessible to the most underprivileged person. In this case, it would be Kak Fatima. So when we talk about healthy living, before we jump ahead and assume that they're unhealthy because they made the bad choice, or they don't go to a clinic, or they don't eat their medication, we have to stop and we have to ask, have we made it possible for them to do so as a community? This is a picture of my team at one of the PPRs in KL. People think that it's only the rural communities that don't get access. But the case of the urban population is actually a lot more complex. So I think if I have to say one thing, and if I'd like you guys to take something home, it's healthy living exists within systems. And I think everyone plays a part in making these systems a lot more kinder, a lot more stronger, and a lot more connected. Thank you.